Welcome back, health enthusiasts. Today we dive into a topic of utmost importance, the 16 signs and symptoms of lung cancer. Lung cancer is a prevalent and serious condition that affects countless individuals worldwide. The key to combating this disease lies in early detection and understanding the warning signs. These symptoms are often overlooked or mistaken for less serious conditions, which can delay diagnosis and treatment. From very mild to severe, these signs vary greatly, yet they all point towards the same disease. Recognizing these symptoms could potentially save a life, making this knowledge indispensable. So let's venture into this vital discussion. The first sign we will discuss is a persistent cough. A persistent cough, particularly one that gets worse over time, can be a key sign of lung cancer. This is because tumors growing in the lungs may cause irritation or blockage of the airways. This blockage prompts the body's reflexive response to cough in an attempt to clear the obstruction. The cough could be dry or produce mucus, but the key is that it's persistent and doesn't go away with typical cough remedies. So if you notice a persistent cough, don't ignore it. Next, we move on to a more alarming symptom. Number 2, blood in your cough. Coughing up blood, also known as hemoptysis, is a symptom that should never be ignored. When lung cancer takes hold, it can cause damage to the blood vessels in the lungs. This damage can lead to bleeding, which may then trigger a cough reflex to expel the blood. It's not always a torrent of blood. Sometimes it's just a streak or mixed with mucus. Nonetheless, it's alarming and for good reason. Hemoptysis is a serious symptom that requires immediate medical attention. Number 3 on our list is difficulty breathing. Dyspnea, or difficulty breathing, is another key symptom of lung cancer. This distressing sensation can result from tumors obstructing the airways or causing fluid buildup within the lungs. Imagine trying to breathe through a straw or feeling like you've just run a marathon, even when you're at rest. This could be a sign of lung cancer and should not be ignored. It's crucial to listen to your body. Remember, if you're experiencing difficulty breathing, seek medical help. Our next symptom is a bit unusual. Number 4 is strange sounds when breathing. Abnormal sounds when breathing can also indicate lung cancer. The types of sounds you might hear include wheezing, a high-pitched whistle-like noise, or stridor, a harsh grating sound. These sounds are often produced when airways are blocked or narrowed, which can be caused by tumors or inflammation in the lungs. Sometimes these sounds can be quite subtle, barely noticeable. That's why it's crucial to pay close attention to any changes in your breathing. Now let's talk about number 5, frequent infections. Frequent lung infections, such as pneumonia or bronchitis, might be a sign of lung cancer. Now, you might be wondering, how does that work? Well, lung cancer can potentially weaken the immune system, making the body more susceptible to infections. It's like having a fortress with a broken wall. Invaders can easily get in. This is why a sudden increase in lung infections could be cause for concern. It's your body's way of raising a red flag, signaling that something's not quite right. If you're experiencing frequent infections, it could be a sign of something more serious. Number 6, chest pain. Chest pain, especially if it's persistent or associated with coughing, may be a sign of lung cancer. When lung cancer takes root, it can cause pain by invading the chest wall or even the ribs. This pain can be persistent, often intensifying with deep breaths, coughing, or even laughing. It's important to remember that any chest discomfort is a clear signal from your body that something may be wrong. Chest pain should always be evaluated by a healthcare professional. Moving on to number 7, hoarseness of voice. A change in voice or hoarseness can be a sign of lung cancer. This symptom arises when lung cancer impacts the nerves that control the larynx or voice box. The larynx is responsible for our speech, and when these nerves are affected, it can result in a noticeable change in voice. This change may sound like a persistent hoarseness, a deeper tone, or a rasp. It's important to remember that these changes can also be signs of other conditions, but if it persists, seeking medical attention is crucial. If you notice changes in your voice, don't dismiss them. Now let's move on to number 8. Number 8, hiccups and dyspnea. Persistent hiccups combined with difficulty breathing might be a sign of lung cancer. This may sound surprising, but here's the connection. Lung cancer can cause irritation and pressure on the diaphragm, the muscle beneath your lungs responsible for breathing. This irritation can lead to persistent hiccups and shortness of breath, also known as dyspnea. It's important to remember that while hiccups are usually harmless, if they persist, it's worth getting them evaluated. Number 9, difficulty swallowing. Difficulty swallowing or dysphagia can be a sign of lung cancer. This might seem odd given that swallowing is typically associated with our digestive system, not our lungs. However, lung cancer can put pressure on the esophagus, the tube that connects your mouth and stomach. This pressure can cause discomfort and even pain when swallowing. It's a less common symptom, but it's important to note, as it can often be mistaken for other conditions. If you're having trouble swallowing, seek medical attention. Number 10 on our list is pericardial inflammation. Inflammation of the pericardium, the sac around the heart, can be a sign of lung cancer. Here's why. This type of cancer can spread or metastasize to the pericardium, causing inflammation. This pericardial inflammation often results in symptoms like chest pain, shortness of breath, and a feeling of general discomfort or unease. Remember, these symptoms are not exclusive to lung cancer, but if you're experiencing chest pain or other heart-related symptoms, it's crucial to seek medical attention immediately. Now let's move on to number 11, the superior vena cava syndrome. Superior vena cava syndrome, a condition caused by the blockage of a large vein in the chest, can be a sign of lung cancer. This syndrome manifests itself through noticeable symptoms such as swelling and a distinct redness that starts appearing on the face, neck, and upper body. These symptoms are caused by the obstruction of the blood flow in the superior vena cava, a large vein carrying deoxygenated blood to the heart. It's crucial to remember that superior vena cava syndrome is a medical emergency and requires immediate attention. Number 12, Pancoast Syndrome. Pancoast Syndrome, a rare type of lung cancer, presents with unique symptoms. This condition is characterized by a tumor located at the top of the lung, leading to specific signs that set it apart from other forms of lung cancer. One of the most common symptoms is persistent shoulder pain, which can sometimes extend down the arm. This discomfort is often accompanied by muscle weakness and a loss of sensation in the same area. Pancoast syndrome is rare, but its unique symptoms can help in early detection. Number 13, Hoarseness syndrome. Hoarseness syndrome, a condition that affects the nerves to the eye and face, can be a sign of lung cancer. It's characterized by a set of specific symptoms that may seem unrelated at first glance. Drooping eyelids, also known as ptosis, and decreased or uneven sweating on one side of the face are all signs of this condition. Hoarseness syndrome is often caused by damage to the nerve pathway between the brain, face, and the eye. While it's a rare manifestation, it's a noteworthy pointer towards lung cancer. Hoarseness syndrome is another rare but telling sign of lung cancer. Number 14, Carcinomatous Lymphangitis. Carcinomatous Lymphangitis, a condition where cancer spreads to the lymph vessels, the vessels responsible for drainage of interstitial tissue fluids and inflammatory cells in our body. This could be a sign of lung cancer. This occurs when malignant cells find their way into the lymphatic system, obstructing the lymph vessels. This obstruction can cause a multitude of symptoms, with the most common ones being shortness of breath and a persistent cough. It's important to remember that the presence of carcinomatous lymphangitis often indicates a more advanced stage of lung cancer. Now, let's move on to number 15, weight loss. Unexplained weight loss can be a sign of lung cancer. This might seem like a welcome surprise, but it's not. You see, lung cancer can disrupt your body's normal metabolism, causing it to burn calories more rapidly, or it could suppress your appetite, making you eat less than usual. Either way, the result is a drop in your body weight that you didn't plan for. This is a subtle symptom, often overlooked until it's quite pronounced. If you're losing weight without trying, it's important to seek medical advice. Number 16 and last on our list is metastasis. Metastasis is the spread of cancer to other parts of the body. It is a late sign of lung cancer. This alarming progression occurs when cancer cells break away from the original tumor in the lung, traveling through the bloodstream or lymphatic system to distant organs. Whether it's the brain, bones, liver, or adrenal glands, the symptoms vary greatly depending on the affected organ. This could range from headaches and seizures to bone pain or jaundice. Metastasis indicates advanced disease and immediate medical attention is necessary. These 16 signs and symptoms can help in early detection of lung cancer, which is crucial for effective treatment. It's important to remember that having one or even several of these symptoms doesn't necessarily mean you have lung cancer, but if you're experiencing any of them, it's essential to seek medical advice. Early detection is the key to successful treatment and can significantly improve your chances of beating this disease. The symptoms range from a persistent cough, difficulty breathing, to unexplained weight loss. These symptoms may seem common, but they could indicate something more serious like lung cancer. It's essential to listen to your body and not ignore these signs. Remember, your health is your wealth, and taking proactive steps can make a world of difference. Lung cancer, like any other disease, can be managed more effectively when caught early. I hope you enjoyed today's video. If so, hit the like button and subscribe for more up-to-date health advice.